Hello, I'm Brandi Higbee, and this is my abstract presentation for the hypothesized bio-tensegral model of scar tissue observed in anterior cruciate ligament reconstruction surgeries, a case report series. The purpose of this case report series is to ask the question, how can an anterior scar inhibit an entire knee's range of motion? Does a scar possibly engage beyond the tissue of a localized scar itself? The purpose of this case report series is to propose a theory that scar tissue might affect areas beyond the immediate scar itself, engaging predictable lines of restriction in accordance with biotensegrity principles within the soft tissue that can linger and remain for even years after surgery. This case report series aims to observe the existence of these restrictions across different participants and assess the outcomes after myofascial techniques are applied to the hypothesized patterns. Data was collected from 10 clients aged 20 to 70 years old, and participants had a moderate to high activity level before sustaining a grade 3 tear in their ACL and subsequently received reconstruction surgery. The participation qualifications were that candidates had to be at least 8 weeks post-surgery and at the most 10 years since their surgery, and all were categorized as having a moderate restriction that was affecting their previous levels of activity. 5 50-minute sessions were conducted. Light to medium pressure level 1 to 3 on the Walton scale was used with myofascial techniques. Palpation of the hypothesized restrictions was assessed at each session, and AROM measurements were collected with a goniometer before and after. The results of the case report series were that the restrictions were found in all participants, showing the same identical hypothesized patterns. In some cases they were visible, but all were palpable. After 5 sessions, the clients exhibited 40 to 60% increase in AROM. They also reported less pain and guarding and improved circulation proprioception and balance. The conclusions are that these restrictions are patterns that act like channels of tension that are deeper than the dermis and superficial to the musculoskeletal tissue. They appear to pin down and restrict biological structures and tissues in the direction and circumference to the scar. In this image, you can see how they appear in the scar with just a slight tug of the tissue. These lines indicate a biomechanical compensation. They create a retinaculate-type structure for the scar, potentially enabling new biological channels for biofeedback, assistance in wound healing and closure, localized protection, mechanotransduction, and reestablishing a pre-tensioned fascial system. So why is a pre-tension system so important? Well, it's the basic functionality of biotensegrity and the theory upon which helps to explain all the systems in our body, how they develop and adapt through the course of our life. Tension plus integrity plus biology equals biotensegrity. And the principles are that 1, forces take the shortest path, typically a straight line. 2, structures are closely packed in and the most stable structure possible. And then 3, it's the most efficient use of energy. This was another participant whose lines were visible with and without touch. This is a demonstration that this fascial engagement could possibly explain an entire limb's restriction with an anterior knee scar. Here we can see a participant who was seen before and after her ACL surgery. The third photo is of her knee with the pattern applied to each of the scars of her surgery. It is easy to see how some limitation of both anterior and posterior muscles could develop if these bands ran the circumference of the leg. A few months after the investigation, participants still exhibited improved AROM, suggesting that the restrictions are unnecessary after the wound is healed. It's my belief that us therapists are already attenuating these restrictions with the use of manual therapy and fascial release techniques. It's theorized here that when we understand the pattern, we can be more strategic of the bigger picture that's happening under our hands.